Hi, I'm Dr. Trevor Penny, the Executive Delegate for the AAC, and I asked Sara here to be answer a couple questions. She works for Dr. Trinket. So Sara, how long have you been an office manager?
Well, Dr. Penny, thank you so much for having me here today. It is such a pleasure, and I appreciate you taking the time to ask me these questions. I've been with Dr. Trinket as General Manager of Goodyear Chiropractic since 2004, so that would be for about 14 years, 13, 14 years. So it's kept me on my toes, and I've seen everything up and down, just like you all.
Okay, well, that's good. So you have some experience there.
Yes.
So what do you think office managers would like to see from the AAC itself?
Well, that's a great question, Dr. Penny. I'm so grateful you asked me that, because not a lot of people take the time to ask the managers those questions, who actually see a lot of the front end of what's coming and going while the doctors are back there adjusting.
Well, maybe we should change that.
Yes, and I'm so thrilled I'm here. I'm just overwhelmed. I can't even begin to tell you. But but the big thing is, when Dr. Trinket and I received an invitation to be a delegate, we were overwhelmed with joy, because our biggest thing is wanting to give back to the chiropractic community, to be able to make change and help support that. And us alone couldn't do that as one person, but as a team, we felt like the small amount we can do to help, whatever it is, or big or small amount, we want to contribute as a whole, as a team, to get things done. And we can't stop progress. As a team, we can get it done. So I'm really excited about it, and that's kind of where, when we made the decision for Dr. Trinket to be the delegate, was to make these changes as a team.
And what's specific for like an office manager are you more interested in? Is it more the way the doctor treats the patients, or insurance, or
Mine, not only mine, but I think everybody can concur that our bottom line needs to increase. It's time for chiropractors to see that increase. It's not fair, and it's gone too long. There are too many rules and stipulations and unfair situations where I think we can make a change to the bottom line for everybody, and it would help just a small amount of everybody working hard together to make these changes.
Well, that's what the delegates are all about.
Yes.
And do you think that, have you talked to a number of other office managers?
Yes.
They think the same thing?
Before I came here today, I reached out to some wonderful doctors and said, hey, is there anything I could bring up in the meeting? Some of them were saying how it's just highly unfair that the non-par versus not par, that MDs get to be not participating with Medicare, but chiropractors have to be non-par. And if there's any small error, we're federally offending the federal government, however you say that. So it's really important to us to get some fair treatment.
Okay.
Not only that, United Healthcare won't even pay for x-rays anymore. They just shove it in their per diem. So
I didn't even know that.
yeah, we're very offended by them cutting our bottom line. We want to expand our bottom line.
Okay, well, that's exactly what the delegates are going to be doing. That's what the AAC wants to do, and that's the direction we're going. So thank you very much for being here, Sara.
Thank you for having me, Dr. Penny.
You're very welcome.
You are so wonderful. I appreciate you so much.
You're welcome. We'll see you at the next meeting.